Hi YouTube. I haven't uploaded a video this week, and I've been meaning to upload videos, and I keep thinking about things I want to vlog, and then I forget them. But this is a surgery video again. I'm getting close to my travel date, which is next week, and I'm really excited. But obviously also everybody who is in the middle of this journey is kind of scared as well as excited for a lot of reasons. And the topic I want to talk about today in the whole surgery journey subject area is the biggest fears that dolls have when it comes to surgery, and surgery in the Dominican Republic in particular, and that is death and waking up, surgical complications, things like that. So there was a news story this week about a doll in New York who passed away, and the news story led with the fact that she had at some point during this year had surgery in the Dominican Republic. I don't want to speak about that particular case too much because I don't know about it. And the news article was in the New York Daily News, I believe. It was not very informative, and it served a purpose of scaring a lot of dolls without actually giving any information. People who are familiar with the journey and the basics around it, they noticed some things in the article that didn't seem to match up with what they know about the process. The doctor who operated on the doll has spoken about it and given some facts. So I think that set a few people's minds at ease, but you know, it's still something that lurks in the back of everybody's mind. I think wherever you're having surgery, whether it's the Dominican Republic or here. And you know, it's a topic that comes up a lot in support groups on message boards, Facebook. It's just something that people, some people don't like to even say it out loud because they're kind of afraid of, almost like jinxing it, and other people say they want all the information they can get. So it's a touchy subject, obviously, and when it affects somebody specific, it's upsetting and it's scary. So, I just wanted to talk about the subject because, whenever there's a specific incident, whether it's this one or another one, it seems like this idea goes around that it's like a frequency fallacy, that not only did it happen to one person, but there are quote-unquote all these deaths. And, people will share articles that are old, or they'll share articles that are not very conclusive, and I do not have anything in front of me that compares statistics or mortality rates from the United States to the Dominican Republic, et cetera, et cetera. That number has eluded me throughout this whole entire vlogging journey, and I would love to have some more information about it. But, as far as the numbers go, there's so many variables. Like in the case this week involving the woman that was in the Daily News' report, there were a lot of factors there, including the fact that the operation was supposedly quite a while ago, so it can be confusing for people, just to kind of assess risks and risk factors, and, without those numbers, without knowing how many people go for operations, how many people have complications, and what the mortality rate is here versus there, and just those two things separately, it's difficult to tell. And there have been a lot of scary stories and complications and fatal complications coming out of Miami as well. And I don't mean to knock any community or any region, any surgeon, anything like that. This is a topic, and this is very few of us are surgeons. I'm not a surgeon, so it's hard for us to say, what went wrong when something bad happens, whose fault it is, if it's anybody's fault, if somebody was just unlucky, what role aftercare played. So, those were just, they're topics that just seem to be ever present, like it's hanging over everybody's head. And in almost all of the news stories I've seen, the reporting is very bad. It's not, there's no real detail there that could help a person make an informed decision about surgery or risks, or that they could take away to use to protect themselves. Not that that's the purpose of reporting this type of news, but I just see that almost universally because fatal complications from plastic surgery make great headlines, but they don't, they don't really give that much information to the public in the sense that, you can learn from them. So, there are certain aspects to surgery that don't have to do with your surgeon or the location of your surgery or any of those things. And one of the things that are really in your hands as a patient, wherever you go, is, preparation and aftercare. I've seen a lot of people say that, the larger dolls are more likely to get complications. I haven't seen, in terms of serious complications, I mean, with wound healing, there's some information suggesting that wound healing might be a problem. Same thing with smoking. And also, the thing we've discussed before, the aesthetic result, which has to do with your preference and not your safety. I cleared my throat. So, as far as that goes, I haven't seen any evidence to suggest that women who are larger have more of a chance of dying than women who are smaller. And I don't think that's been at play in any of the recent cases that we might have seen. Not many are springing to mind. But, this is also a trope. I mean, it's not an urban legend per se, but many urban legends, and I know things about urban legends, they have a theme about fatal vanities. If you're vain, if you do anything superficial, the urban legend about the women with the tanning booths who cooked to death, or the one about the girl and the tainted prom dress. I mean, these are just classics, but, the morals of the stories are always, don't be vain because it's deadly. And that's a trope that plays out in the news, it plays out in the media, which is not to say incidents don't occur. I'm not saying that there aren't complications, but there's a reason why plastic surgery and elective cosmetic surgery is targeted by news outlets and tabloids versus just regular surgeries, because there is an element of a value judgment there, and excuse me, sorry. That's what those stories are about. So another fear, and it has to do with, kind of has to do with death and just general surgical fears. In a conversation that I saw today, somebody said they were afraid about waking up. And, one person answered, don't worry, you'll wake up. But another person answered about waking up during surgery. And that's one of the other big fears I see a lot in this community, is waking up during surgery in the Dominican Republic. And I think something that really needs to be kind of, delineated here is that in the United States, people typically undergo procedures with general anesthesia. And to my understanding, most doctors in the Dominican Republic do not use general anesthesia. They use a combination of an epidural block and something that sedates you so you're not awake for the procedure. However, a lot of dolls have reported waking up briefly. Some claim they were awake for more than a brief period of time, but it's very difficult to say because when you're under a sedating drug, you don't really have the best recall, or judgment or anything like that. So it's not to say people are lying or that they even imagine things. It's just hard to say about the waking in general. So when Americans think about waking up during surgery, we tend to think of the stories that we've read about people who were under general anesthesia and were paralyzed. They couldn't move or signal by blinking or anything, and they were able to feel a major surgery. Excuse me, sorry. In the Dominican Republic, and in these surgeries, waking up is a completely different thing. You're still anesthetized. People have discussed feeling things, although for the most part, I've seen people say pressure, not that they feel pain, although people have said that. But most dolls who have spoken on this matter have said that they felt pressure, not pain, and they were only awake briefly. So that seems to be the most common experience. And as far as waking up from surgery goes, you know, it's not the same as a general anesthesia surgery where, you know, you're sedated heavily and, you know, people sometimes might not wake up from that. And I think one of the reasons why the anesthesia protocols may be different there is because it, you know, may be safer. So, I mean, I'm not sure safer in the context, just, you know, Americans tend to be the most, you know, medication and sedation friendly country that I'm aware of. I mean, I lived in Ireland for a while. I'm married to somebody from England. You know, we tend to go towards medicine, and not that there's anything wrong with that, but, you know, we tend to be more, more reliant on, you know, medicating issues, whereas, you know, in other countries, they're not so much like that. So it's like a culture thing, and it's the way medication and medical services are rendered to people. So, you know, I think that people, when they talk about waking up and the pervasive fear of waking up during surgery when it's unwanted, there's a bit of conflation between, you know, waking up during a procedure that they've read about, like in a magazine where somebody had one of those horror experiences, or, you know, just briefly gaining consciousness and going right back to sleep. Now, since I haven't had my surgery yet, I can't say what my experience is, and I do hope to document as much as I can, because I know that a lot of these things are worries for people. And, you know, when I make videos like this and I talk about topics like dying and mortality rates and statistics, and I kind of, you know, I have these same, you know, we all have to go to bed at night, and we all have to have those last thoughts before we go to bed, and, you know, we're all afraid of, you know, being the outlier, which is what these complications are. They are outliers. And in case you, what an outlier is something that's outside the norm. It's a deviation. So, you know, I'm sure at times in our lives we've all been outliers, and we've all deviated from the norm, and we've all had these circumstances occur for us where, you know, oh, well, this never happened to anybody else, but it happened to me, and it's terrible. But excuse me, I'm really sorry. But, you know, it's important to know that many cosmetic surgeries are performed in the Dominican Republic. It's a very popular destination for dolls from every country, you know, regionally. I mean, probably on the other side of the world, they might go to Thailand more for surgical tourism, but that's a digression. The point is that people come from all over to get surgery in the Dominican Republic, and I don't know, again, what those numbers are, you know, how many surgeries are performed a day, how many, you know, what the complication rate is, but I do know that, you know, we hear about one person, you know, who unfortunately dies, and it's very sad, but it's also very rare. And, you know, it's in the news. If it was something that was happening regularly, it would be in the news a lot, and it's not. I mean, there's a reason why when somebody wants to talk you out of it, they share an article on your wall. It's from 3 or 4 years ago, because there are just not many cases like this happening. And I've seen the same thing. This is also kind of off the topic, but in a recent conversation on social media I was having with people, sorry, this always happens to me on YouTube, about deep vein thrombosis. Sorry, that sounded like deep vein thrombosis. So as you know, flying is a risk, and women in our age range are at risk for deep vein thrombosis, although it's pretty rare. And an interesting contrast that I brought up in the discussion was that somebody said, you know, I read all the doctor's warning, or I've seen warnings about blood clots and flying, and that's something doctors do say a lot in their answers. Now, I, again, did not prepare with a link, but I found an interesting contrast. So doctors will say, I wouldn't recommend flying anywhere for surgery to somebody who's going to the Dominican Republic. And then in another post, you know, somebody's like, oh, I have to fly a week after my surgery. Will I be okay? And doctors say, oh, yeah, you know, you can fly after surgery after this period of time. It's totally fine. You know, if the risk was that large, we wouldn't be doing it. So their answers change depending on the topic. I mean, they have their reasons for not wanting people to go to the Dominican Republic. I don't think that it's all like a financial thing. I think some of their concerns are valid, and I think there are some risks we take on when we travel for surgery. But it was interesting to see that contrast between doctors saying, oh, the risk of blood clots is so high on one post, and then on another saying, if it was that high, we wouldn't perform these surgeries, and you can travel as soon as 7 to 10 days is up. So, you really have to look around for these inconsistencies, not because, you want to cash the doctors out, but because you want all the facts that you need to be prepared for your surgery, and you want to take every precaution. That's another thing I really wanted to touch on that has been coming up in these conversations, is that, everybody who goes for an elective surgery and who opts to do that, we all have to prepare ourselves. And, when you're traveling and you're going to be away from your surgeon, a week to 10 to 12 days after your surgery, you really have to educate yourself on aftercare, educate yourself on wound care, educate yourself on infection, educate yourself on the signs of infection. Make sure that you know exactly what is supposed to happen, what's not normal, what needs to be treated. Some people have said that it's difficult to line up aftercare. I do have a doctor. I do not have a plastic surgeon, but if you can, try to arrange something before you leave with a doctor who's supportive, and explain which complications you are concerned about, and discuss those specific ones. Like in my last visit with my doctor, we talked about seromas and draining seromas, and she said I could come to her for treatment, so that's great. I do have some, but you may not find the perfect situation. You may not find somebody, and that's okay. It's not the worst thing in the world. You can't control, if somebody's going to treat you or not. You can just do your best. But, wound care, make sure you know what things you need to bring to stay clean. Make sure that you're wearing a clean faja over, fresh wounds. Just make sure that you learn as much as you can about caring for yourself. And that's not to say you're not going to get aftercare there, because from what I understand with my surgeon in the recovery house, that all the dolls stay in afterwards. I'm sorry. The aftercare is excellent, but at the same time, there'll be instances where you're going to be on your own. Nobody's going to be watching you 24 hours a day. So, and I'm not saying aftercare had anything to do with any incident whatsoever. I'm just saying that there's what we can control and there's what we can't control. And, you've decided this particular journey is yours and you're on it, and there's what you can control and what you can't control. You can control monitoring, checking your blood before you go. I'm sorry, I always forget to turn off one particular type of notification before I start a video. You can monitor your health before you go. You can bring supplies to increase or decrease your chance of getting an infection. You can read as much as you can about your doctor, learn as much as you can about your recovery house, make sure your parameters of travel are safe. And again, none of this has anything to do with any specific case. I just want people to understand that some of this is in your hands and you can control it, and you can do this. You can take care of yourself. So, people don't like to talk about death a lot, and I'm saying that word specifically because, so many times it comes up and people, it's like they're saying Voldemort, like, if you say it, it'll happen. Read about cases, any plastic surgery cases that you can find where there were adverse outcomes and deaths, and see what the causes were. Look at the rates for those causes. Learn as much as you can. Put as much in your control as you can, and then, the rest of it you have to really just trust your surgeon and and if you don't trust your surgeon, you should trust your surgeon. That's not something that we should be talking at this point, but you should trust your surgeon. And if you don't trust your recovery house, find one that, you can trust. Find a nurse perhaps, but, if you feel overwhelmed, if you feel like, these things are getting away from you, you're scared about one part of your journey, don't be afraid. Reach out to people in the community, ask questions, ask for recommendations. No question is too stupid. Excuse me, sorry. Everybody had a point. Sorry, everybody had a point where they're completely new to this. So this video has gotten really long, and it's like a one-topic video, and I'm really sorry. But I just wanted to talk about death and waking up, because these are the two things I think scare dolls the most. And as somebody who has way less than 2 weeks until I go, these things are on my mind sometimes as well. And, I hope you're not going to see excerpts of this video on the news in 2 weeks or 3 weeks. I doubt it. I trust my surgeon. He's, he really cares. Not that any surgeons don't care. I've seen them all interacting on social media, and they all seem like really nice people. Some of the more popular doctors, the ones, and I'm not seeing them, but I'm just impressed by their candor. I'm impressed by the fact that they are willing to take on these hard subjects. They're willing to disclose, what happened from their side in these cases, and, sorry, somebody's coming down the stairs, but that's just something I wanted to discuss, because I know that a lot of you are afraid. I know that I'm afraid, just in a normal sense. I'm nervous about surgery. I'm nervous about taking this big step. I'm nervous about traveling. I'm nervous about packing everything. I'm nervous about what the Wi-Fi signal is going to be like, if I could reach my coworkers. So, I'm nervous too. So if there's anything you want, me to look into, or if you have any questions or comments, please comment, ask them. You can tweet me at Kim LaCapria, and I'll be happy to talk about anything, because I really want to document this journey for everybody else who is coming after me, who my videos might help. And I'm sorry this video went so long, and thank you for watching.